because every autoimmune disease gets controlled the same way. I mean, we don't know why these autoimmune diseases occur. It's some kind of genetic problem. They all attack different parts of the body, right? Why do they do that? I don't know, but they do it. But then these regulatory T lymphocytes, their nickname is the master regulator of the immune system. You know, and they're a fascinating story if you ever want to read about them. When I was in medical school, I was in medical school from 1990 to 1994. They were called suppressor T cells. Okay, but nobody could figure out what a suppressor T cell was. And it got so confusing that they actually stopped doing research. And then somebody resurrected research on it, and they changed the name from a suppressor T cell to regulatory T lymphocyte. Okay, and then the guys that did this research were brilliant scientists, you know, and they deserve a lot of credit. And they started figuring out that these things turned off autoimmune diseases. That's what they do, and it helped. Once they figured that out, the research just blossomed. I mean, if you do a literature search on regulatory T lymphocytes, you're going to see a lot of articles. You do literature search on regulatory T lymphocytes and vitamin D, you're going to find a lot of articles. I mean, I found a lot of those articles, and I put them in my paper because I'm just convinced that this is how it works. This is the mechanism of action of how psoriasis is controlled by vitamin D, because its effect on the regulatory lymphocyte. Everything about the regulatory T lymphocyte depends on vitamin D. It causes its formation, and it maintains its functional status. And probably all the things that it does that cause it to turn off the autoimmune disease depend on vitamin D. There was a really interesting paper published in 2013 by a guy, I forget his first name right, or his name, but he talked about regulatory T lymphocytes and how they control psoriasis and all these different mechanisms of actions, all these different things that they make and what they do to turn off the autoimmune disease. Never once did he mention the word vitamin D. Not one time.
Right.
Matuzzi, I think was his name, you know, but it was all the vitamin D that caused all that stuff to happen, no doubt. I've got, okay, here's a list of people that I have in my life who had diseases that have gotten better with vitamin D when they followed my advice. Graves' disease, 30,000 units a day. She had proptosis or Eisenberg on her head. Doesn't happen anymore. She gets off her medicines for Graves' disease. And I always tell everybody, if you take what I'm telling you to do, it's going to be safe. Just make sure you get blood levels checked. Tell your doctor, I need my calcium checked, my PTH level checked. And if they're normal, it's going to be okay. The biggest problem they have is interacting with their doctors because they all think they're going to die, you know, or something really terrible is going to happen. 30,000 units a day control Graves' disease. 30,000 a day control the husband and the nurse with multiple sclerosis. 20,000 a day controlled lichen planus in a physician friend of mine, which was in her mouth. 10,000 didn't work as well. She's now taking 50,000 because she's got recurrent breast cancer. 40,000 was helping a friend with rheumatoid arthritis. Several people with 10,000, 20,000 units a day have asthma under control. A friend with Crohn's disease takes 40,000 units a day, gets off her medicines. She said she stopped taking it for a couple of days because you feel good, you forget to take it, and wham, it hits her right in the stomach. She gets back on it, it gets better. You know, and that's one of the fascinating things with psoriasis that got me really thinking about it. Was I remembered in medical school in 1993 learning about topical vitamin D would help control psoriasis. And I never forgot that, but I never really got interested in treating psoriasis until I discovered the vitamin D problem. And then I learned how phototherapy can control it. But if you stop the phototherapy, it comes back. If you resume the phototherapy, it gets better. It doesn't cure it, it just controls it. Autoimmune diseases aren't cured by vitamin D, they're controlled. If you stop taking it, the disease comes back. And psoriasis is a fascinating disease to study because you can see it. You know, there's no question whether it's there or it's gone. You know, nobody can argue with you about it, right? You can see it. So why is that? So I started thinking, why does vitamin D control psoriasis, and why does it come back if you don't keep taking enough vitamin D? And it's either you either got to keep the sunshine going, or the phototherapy, or the oral supplement, right? So to me, I thought, you know, I was helping my kids study genetics in the 6th grade 10 years ago, or longer now, and we were studying basic Mendelian genetics, and that's where the thought occurred to me. psoriasis and other autoimmune diseases are autosomal recessive diseases that become dominant in a state of vitamin D deficiency and recessive in a state of vitamin D sufficiency. So then the question was, how the heck does that happen? And then one day, somehow I stumbled on the regulatory team of the site literature, and that's how I put it together. And Coimbra came to the same conclusion because of the vitiligo back that he was treating with that he had Parkinson's disease, and he had him on the vitamin D because of the Parkinson's disease. So then the only study that he's ever published was in 2013, where he had 25 patients, 9 of them had psoriasis, and 13 of them, or 16 of them had vitiligo. And he treated them with 35,000 units a day every day for 6 months and got them all under perfect control. You know, the vitamin D levels went up. The highest one was in the 200s. They were all low to begin with. Nobody got sick. Nobody had any kidney stones. Nobody had any renal failure. Nobody had hypocalcemia. PTHs were detectable. You know,
well,
life was great.
All the fear about toxicity. You know, all those doctors who are listening to the IOM and their recommendations and are afraid to go above that. Just none of that.
It's first cause no harm, right? But in the IOM's quest not to cause harm by giving too much, they're causing harm, way more harm by not giving. Mm-hmm. It's not intentional, but it's just not knowing the literature. And now that I know that they're aware of this literature, but they're still not changing what they're saying. And why is that? You know, well, it's hard to admit you're wrong sometimes.